Well, hello, everyone. Today we have Dr. Hermaj Makwana with us, and he has recently joined Lima Memorial's team of cardiologists at the Lima Memorial Hospital's Heart and Vascular Institute. So thanks so much for joining us today, Doctor.
Thank you. My pleasure.
All right. Well, firstly, can you tell us a little bit more about yourself and your areas of expertise and certification?
Sure. So I'm Dr. Hermaj Makwana, one of the interventional cardiologists. I just joined Lima Memorial Heart and Vascular Institute. I've been doing this for almost 20 years. I had a long journey. I have multiple board certifications. Initially, I started my journey with internal medicine. Then I did a critical care medicine, followed by some research in hypertension and vascular biology. Then I did a cardiovascular disease fellowship and interventional cardiology fellowship. So basically, I'm board certified in internal medicine, critical care medicine, cardiology, interventional cardiology, vascular medicine, endovascular intervention, nuclear cardiology, and echocardiography.
All right.
And pretty much I keep all my certification up to date. So, and I practice.
Yeah, that's definitely a long journey. Now, a big question for you, okay? What inspired you to practice medicine, specifically in the area of cardiology?
Especially if you're coming from lower middle class family, a lot of people relate this story because a doctor in India is like a god. And when, as a patient, as a family, when we see the doctor, we feel like now we are safe. Somebody will take care of us. So that feeling is unbeatable. I can pay a price for it. So, so I'll go back to cardiology. So what I was saying is, I like patients. I like to talk to people. I'm a patient person. Yeah. And I think cardiology is the very fascinating specialty because here, on one hand, I'm seeing the patient in the office. I'm talking to a healthy adult, telling him the importance of exercise or diet, lifestyle, weight loss. And I'm trying to prevent the disease. On the other side, when I'm on call, somebody comes with a heart attack and cardiac arrest and dying, and I save a life. So I get extreme of both ends. I can prevent the disease, maintain the disease, extend life, or improve the quality of life. On the other side, also save a life. So I think this is very, very satisfying profession. And I don't think, what would I do if I was not a cardiologist?
Yeah. Now, how do you approach shared decision-making with patients? And what kind of steps do you take to actually involve them in their care?
This is a very, very, very important question. I think most of the doctors don't understand that it's not just your knowledge and you treat the patient. You're not treating the patient, you're taking care of the person. And I think that shared decision-making is a very, very important topic we're discussing today. Basically, what I do when I have a patient in the office, I of course assess the patient and have a plan in my mind, and I tell the patient, listen, this is what I think happening, this is what I believe, but you are an important part of the team. We are going to work together. Okay, I want you to tell me, and if you're any concern, we can talk about it. So I basically try to develop a relationship. I try to develop a trust between us. That he's not just being told what to do. He can say something. He has an input in his treatment plan. So that's number one. So like participation for the patient. Number two, I explain to him all the options. This is what I think. Only medicines or some procedure or some surgery. And I will give pros and cons. Okay, these are the plus. This can happen or this complication can happen. So he understands what are the risks involved in each plan.
That's awesome.
And that's very good because sometimes as a doctor, I can tell, hey, this is the best for you. It doesn't go there. We have to look at the picture, large picture here.
Yeah, working together as a team.
Yeah. And third thing is also very important that you look at the patient and their belief, like what the cultural belief or their religious belief or where they're coming from, what is the environmental factor, social background. Those things are very important. Not somebody's like living alone in the middle of nowhere, and you start talking about some complex procedure which needs very intense 24-hour care. He may not even agree for that. So you have to put things together, right? So you also have to respect their belief and their preference about the treatment.
Yeah.
So that's number two. And after all these things, we sit down and we come with the best plan. Then, okay, as a team, I think this is the best option, and what do you think?
Yeah.
And if patient agrees, that's the best thing I think we can do for the patient. And I would say that I've seen that in my personal practice, practicing for 20 years, that it really, really improves patient satisfaction, quality of care, and the trust between patient and doctor. So I think this is something I appreciate, that every doctor can go through this, because we are not just the machine. We have to be a part of patient's family or care.
Right. Now, if somebody would actually want to schedule an appointment with you, how can they reach out to you?
Yeah, please, if you look at the screen, there's a number at the bottom of the screen that you can call that number, and we'll make sure that one of the cardiologists will see you same day. And this is a very, very unique institute. I don't know any institute in my knowledge that can provide the service.
Well, doctor, I want to say thank you so much for joining us today. I do appreciate it.
Thank you, Chris. Thanks for letting me in. Appreciate it.
All right. Well, don't go away, because we have more when we return.